Transform in the workforce, you've pretty much heard about all the kind of strategies that you can implement. Some of the things that I guess specifically you might want to think about is things like advertising straplines that positively promote application from people with lived experience. And it's quite a challenging one to the organisation because interestingly we put things like in the person's specification of lived experience as a desirable quality. And amazingly, a number of staff said, oh, really should you be putting that down? So it actually opens up the organisation to have a dialogue about the things that they're most uncomfortable about and thinking about why that is and what you might do about it. Yes, now I think building capability in employee peers. When I came to Manchester, they said, we want peers, we want recovery education, just give it to us. So I gave this big project plan and said, this is how you can do it. And they simply were not ready. You can't just do it just like that, it just doesn't happen. You've really got to do a lot of this other stuff to get people's openness, to get their mind and their understanding and their practical implications. That understanding has to be there. Because although I gave them kind of, blueprints for getting peer employment, which is what we did in Cambridge, and we had 50 peers within 6 months, you need to have that really visionary leadership at the top to achieve that. So I'm still working on that, and we're doing recovery education first, and I think that will be very important because it does challenge the notion of what we're doing and the way we're doing it, and how peers can be really important in that. The other thing it's really important to do is that that notion that you as an organisation can do it all is clearly not the case. You're one organisation, whether you be statutory or non-statutory, in a whole network of organisations and voluntary sector, and you all need to be thinking and working along the same lines, or else barriers will come up in different places. So try and think about ways of developing some kind of collaborative network that helps you all talk about what that means and how you can work together. Certainly where we are, we're looking at recovery education as a partnership development, so different agencies will come and deliver or deliver within their own area, but we're all going to be working together around co-production and delivery of recovery education. So I've slightly alluded to some of the framework around implementation. You need to engage people and you need to understand what they know about recovery. Think about their own learning and development and think about how that application of what you're doing is going to have an impact on their business and the return on investment, because people will go, this is lovely, but it's not going to cost us anything, is it? And some of these things will cost things, but there are other things that won't cost too much, and maybe you need to focus on those first to get the buy-in and sign up and understanding. So you need to understand where they're at, and you need to understand what the stakeholders think is important. Understanding where the organisation is really important, and by all stakeholders I really literally mean all stakeholders: directors, chief executives, the workforce, the middle management, the people receiving services, their supporters, their carers, the other organisations. Everybody needs to have a broad understanding of what recovery is all about, and that's what makes it so complicated. Don't assume that you've loved and read the book and of course everybody else has too. Clearly there's an awful long way to go for some people, and I've been around looking at recovery, I guess, for about 7 years, and I don't think I really know all of it, and I certainly knew you obviously go to different places and you learn different things to different people. But some people have only just started talking about it really and understanding. Some people say they know about it, some people say they've been doing it for years, and I'm kind of in some ways I think they're the people I'm most anxious about, because that kind of, they close down the conversation really by having those and making those statements. But you've got to understand where the stakeholders are at and thinking about how it's relevant to them, and where can you find a commitment, where can you help sign up, what can you help find that is a buy-in for them, and what do they need to know that they don't know already that might help them in that commitment. And I guess the last thing is really, if you've talked to them about recovery and at the end of it they still don't, they can say, well, I understand when you tell me about it, but I can't tell somebody else about it. That's the problem. Because the ripple effects are going to stop there if they can't then communicate that. So you need to find a way that's okay for other people to talk about it. So it has implications for culture, skills, attitude and behaviour, and therefore the stakeholders need to understand those implications, and I think that's why it becomes more, it's a very evolutionary thing. So the learning programme is particularly important. And I don't mean necessarily formal learning programmes, but it is about being invited to different forums and you're asked to talk about different things. I've been asked to various teams, I've been asked to service user groups, I've been asked to voluntary sector organisations. You get asked to different places to have that dialogue. So, whatever you're doing is about staff and people receiving services working differently together, and that people will be enabled to make use of the services differently. They're empowered to use communities, we've had quite a bit of that already, and it's a change in culture. So, certainly from my experience of working in 2 organisations, you need something that throws all that up in the air, okay, a disruptive innovation. This isn't a particularly academic explanation of disruptive innovation, but effectively, it's an innovation that creates a new market by applying a different set of values, which ultimately and unexpectedly overtakes an existing market. So whilst I think it's really important to do all of those things, to sit whatever you're doing in a massive organisational context, you need something huge that puts a rock into the pond, not just a pebble. I've worked in one organisation that did peer employment first, and one organisation that's doing recovery education first. Now I think it depends on where your organisation is at, and you're the ones that can gauge that. Where I'm at now, they really weren't ready for peer employment. They wanted it, but they're not ready for it. Whereas I think recovery education will help the organisation become ready, because within it is peer employment, effectively. Because it's all about co-production and co-delivery and ultimately co-receipt of education and learning. But what it does is it moves services specifically away from reducing symptoms to rebuilding lives. That's mainly the function of recovery education. It's not saying that reducing symptoms isn't important, but people will continue to have symptoms, or they may have relapses, but they continue to rebuild their lives in the presence of absence of those things. So it does model different relationships between people using services and the people who deliver those services, which is a fantastically innovative way of working, and it does challenge staff, but it also challenges people receiving services, puts them into a different relationship, so it puts everybody into a different place. Yeah, so the last thing I guess is about preparing people for employing people with lived experience in the organisation, and as Julie quite rightly says, nationally there's going to be about 30% in any one organisation of people with lived experience. And of course all our organisations have got them, but certainly not everybody knows who they are. There isn't necessarily an open culture about that. So what recovery education does is says it's actually okay to have lived experience and to be able to deliver services. So it really throws that into the melting pot as well. And enabling people to become experts in their own self-care and develop the skills they need for living and working. We've not really been traditionally very good at that in mental health. We kind of think we need to be the ones that care for people, even though they live in their own homes 99.9% of the time, we have nothing to do with them. Okay, so I've already kind of alluded to this. You need support at the highest level. And you will struggle with things like if you've got a chief executive change, then you need to be in there talking to them about what you're trying to do. Even directors change, and then you need to be talking to them as well. If you haven't got that, you can tinker around the edges, you can do your strategy, you can get your pledges, etc., etc. You can do your work in your HR department, but you'll never get recovery education and peer employment going. You need to have that highest level of support. And you need to be thinking about what some of the outcomes are going to be. And I mean, it's fair to say that there's not that much literature around the outcomes in this country, but there is enough for you to be able to say this is a drive. And obviously INROC's there providing a lot of underpinning evidence. And there'll be more and more over the forthcoming years for you to look at. Final slide. What will you need? A deeply held vision of the future. You've got to hang on to that because people will rock it and they'll try and knock you down. You need to have commitment and you need to be resilient. You've definitely got to be willing to keep going because you'll have good days and bad days, and sometimes you'll have really bad weeks. Yeah, you have to be creative, persuasive and flexible. And you absolutely need to listen, because if you don't hear where people are at and are able to respond to that, you can't really adapt what you're doing. I've already said try and find the places that you can push really easily, because otherwise that bit about resilience, you're never going to, the weight training you do will not cover it. And it's interesting that even the most avid supporters will sometimes say things that make you think, I thought you knew, you got this. but you don't. And you know you've still got a lot more work to do. So don't be surprised.